Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 10 minutes before 10 o'clock. Thank you for tuning in. Every day in the news, there's another story about the opioid addiction crisis in our country. If it has touched you or your family, then you are now turning up the volume on your radio because you want to know what we're going to talk about. Well, there might be some good news in this next 10-minute interview. Dr. Michael Frost is on the phone. He's a board-certified doctor in both addiction medicine and internal medicine. He's a researcher. He has written multiple academic publications. He's a master trainer for the Probuphine implant procedure. It's probably the one word I mispronounced, Probuphine. I'm going to find out in a second. This is an implantable treatment for opioid addiction. Let's find out how this works and what this is. Dr. Frost, good morning, sir. How are you?
Good morning. Thanks for having me.
And where are you located?
I'm here from Philadelphia.
All right. Well, thank you for calling in. So did I get it right? Did you correct anything I got wrong before we go any further?
You were close. It's Probuphine.
Probuphine, okay. Is this something new?
Well, so Probuphine is a fairly recent innovation in the treatment of opioid use disorder. As you pointed out, it's an implant that provides a steady amount of buprenorphine, one of the medications that we use to treat opioid use. And four little rods that get inserted into the inner aspect of a person's arm, and it provides them with a steady amount of medication for a 6-month period.
Okay, so this is this the same as the Narcan nasal spray that we have two of them right here in the studio that a guest brought us in. If you ever see somebody overdosing, they said, just have them sniff this and it'll help them. Is this right. Is this the same as that?
No, this is different than naloxone, and one of the reasons I'm actually speaking on behalf of Titan Pharmaceuticals today is that we have a lot of treatment options that are available, and they are life-saving for individuals with opioid use disorder. But only a fraction of people, some estimate about 10% of people who are diagnosed with OUD are actually getting on these medications that can impact the disease and save their lives.
So this helps them, this doesn't just get them out of the crisis situation they're in. This helps them wean, I guess, for lack of a better word, off of the drug itself.
Well, opioid use disorder is a chronic brain disease. So just like hypertension and diabetes are trying to bring those types of approaches to OUD treatment. Mm-hmm. So Probuphine, this is generally indicated for people who have already been taking a daily dose buprenorphine medication and are stabilized on it, usually at doses of 8 milligrams or less. They will transition to this to give them 6 months of continuous medication delivery. Now, this is not a standalone medicine. It should be part of a comprehensive treatment plan with counseling and other kind of social supports. And there are some risks associated with the procedure itself, the insertion and removal. But this is certainly a viable option for people who do suffer from obviously have a discussion with their healthcare provider about treatment options.
Right.
So what if a person is being treated for other things like depression?
Well, this is only a treatment for opioid use disorder. OUD is a chronic brain disease. Treatment for other behavioral health conditions, other disorders, obviously have associated treatment.
The signal's a little bit troubling. We can hear you, but it seems like it's a little bit low. Can I ask you to talk to the people who might really want to know what this is? How do they get this? I'm assuming this is through a doctor. Now, this is implanted. How deep is it under the skin?
Well, so this is implanted what we call the subdermal planes. So it's just beneath the skin. This is a procedure that definitely talk to your healthcare provider about. Only specially trained healthcare providers are able to perform the procedure. But certainly your healthcare provider can give you the necessary information, referrals. There's also a website, probuphine.com, where people can go to get safety and prescribing.
All right, I went to your website, and for those who want to go there, it's probuphine.com, Probuphine, probuphine.com. On the website, it shows like 4 little slivers, the little splinters, I guess you would say. Why are there 4?
Well, so 4 implants or rods. That is the amount needed. Each one is a flexible ethylene vinyl acetate. So it's an inert sort of plastic-like material mixed with the medication. And that's what's needed to create the appropriate surface area to give a continuous, steady amount of medication over that 6 months.
And it's for 6 months?
That's right. So this is a treatment that an individual will get this inserted once, and it will last a 6-month period.
Okay, my next question might show how naive I am about this, and forgive me for that. But does the reason that somebody's taking opioids, I'm assuming if it's for pain, does this also take the pain? Does this take the place of the what the opioid was doing, or just the addictive part of it?
So this is not FDA approved to treat pain or to address pain. It is a treatment specifically for the opioid use. Mm-hmm. Not everyone who takes opioids, of course, are addicted. Not everyone is appropriate for every treatment.
Okay, so if they're taking the opioids for pain, and this helps them stop taking the opioids, are they in pain?
Well, again, everybody is a little bit different.
Okay.
Obviously, you got to weigh the risks and benefits of any treatment with the healthcare provider, and also see what other options are available.
Okay.
This is really specific for patients with opioid use disorder who fit these particular criteria.
And are there any side effects if you're doing this treatment?
Well, so any potential side effects or adverse effects, very similar to other products that contain buprenorphine, which has been around a long time. But because this is a procedure, there are obviously some risks associated with the insertion and removal, which is partially why it must be done by a qualified practitioner.
Is this being addressed at the RX Drug Abuse and Heroin Summit?
There's certainly discussion around all available treatments. The RX and Opioid Summit is really a comprehensive meeting of people looking to tackle the crisis from all different angles.
So I said to the listeners in the beginning that there is some good news in this, and I think that you delivered that. It sounds like there is good news. This sounds like a really good piece of information for somebody. But to do the radio tour, or the reason for the radio tour is to get the word out. Is this also for the doctors as well as for the patients?
Well, we want everybody to be aware. I mean, of not the epidemic, but what the treatment options are. As I said earlier, less than 10% of people who are diagnosed with opioid use disorder are actually receiving the medication that could be life-saving. So we want to make sure that doctors are having that discussion with their patients, that individuals are having those discussions with their healthcare providers for themselves or loved ones.
This is really good information. I would recommend the website, and that's probuphine.com, probuphine.com. And any other resources that we might be able to recommend to the listeners?
Well, there are a lot of general resources. Certainly probuphine.com is a great information resource. And ask your healthcare provider, have a conversation about them. They, at this point, are aware of a lot of places that people can turn for support, further information.
Doctor, thank you for being on the air with us today.
Oh, thanks for having me.
And thank you for what you're doing. All right, we'll be right back. This is The Source, WOCA Ocala.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.